Hello, welcome to the Becky and Boca Show. I am very excited about the guest I have tonight because, as you know, I'm a beauty blogger in Boca Raton, and I talk to a lot of women about things that they can do to look and feel better. And I've been able to help a lot of people with cosmetic procedures. But the one thing I really haven't been able to help women with so far is thinning hair or balding on top. And if you're a woman that has that problem, it's devastating. You can do all the other cosmetic procedures, you can stay in great shape, you can dress impeccably, but it's very difficult to cover this up. And in the climate that we live in South Florida, where it's hot all the time, you're wearing very little clothes, no hats, anything like that, it's even more difficult with the humidity. And I haven't really been able to come up with a really good solution. I've brought people on here that talk about hair extensions, and those are great for women whose hair is just getting a little thinner. But you can't put extensions up too high because you can see them. I'm tall, so I'm constantly looking down on women and seeing their extensions at the top of their head when they try to put them up high. But very often that's where we need more hair. So I was very excited that a girlfriend of mine told me about Dr. Alan Bauman. He is a board-certified hair transplant surgeon right here in Boca Raton, right in downtown Boca Raton. And he's world-renowned, and he doesn't only do hair transplants. He's got all sorts of things he can do for people who have thinning hair or are balding. I toured his facility, and it was just amazing. I mean, I went from room to room to room, all sorts of alternatives. If you have a problem with thinning hair or balding, he has a solution. So I'd like to introduce him right now. This is Dr. Alan Bauman.
Thanks, Becky.
And if you'd give me a little bio about yourself and tell me, where you've come from and your education and everything.
Sure. So, I was born and raised in New Jersey, and I went to college in California.
Okay.
But medical school in New York is where I was trained. And I'm a trained general surgeon. I did my surgical residency at Beth Israel and Mount Sinai in Manhattan before I did my fellowship in hair transplantation. But I've been a hair transplant surgeon for 20 years. I've dedicated my entire professional career to helping people who are struggling with their hair loss situation, both men and women who have thinning hair, eyebrows, eyelashes too.
That's right. We're going to talk about that too.
I'm sure we'll get to that. But I've been in Boca Raton since 1997, and we've expanded the office a few different times. And I'm proud to say we now have an 11,000 square foot facility right here
Absolutely gorgeous.
in downtown
State
Boca.
of the art, enormous, beautiful. I mean,
Thank you.
was very, very impressive. I took a tour and
Thanks.
never seen anything like that.
Yeah, we've been in the office now for over 2 years, that new office.
Okay.
Over the past 20 years, though, I've treated about 17,000 patients and done over 8,000 surgeries.
So anybody that walks through those doors that has a problem with their hair, you have a solution, correct?
No question. And
Okay.
not every doctor who treats hair loss can say that. We have probably the most comprehensive treatment program. And that means that whether you have a scalp condition like itchy, flaky, oily,
Because there's all different things
dry
that cause this
breakage
problem.
and such, if you have hair
Okay.
breakage, we can help with that. If you have a hereditary hair loss problem like you would typically see, male or female pattern hair loss, we can help with that. If you have a severe alopecia, a radiation burn from cancer treatment or chemotherapy, we can help with that. So we have solutions for
everybody.
everything all the way down the line. But probably the biggest part of the practice right now is the management of hair loss. So we have over 1,000 patients that come into the clinic each year, and all we're doing is trying to get their hair to grow thicker, better, stronger. So
I
just their
notice
hair enhanced,
You have that room where you take photos in the same lighting, so every time they come, you can measure their hair growth or what's going on with their hair.
Oh,
so
yeah.
you'll know.
That's critical, Becky. I mean, part of the
I'm sure it
evaluation.
is because you don't want to just let it get away from you, and then before you know it.
Correct. So it all starts with the evaluation. But, when patients come in, it can be a very emotional thing. No question about it, for men and for women.
I think it's
when you're
probably
losing
worse
your hair.
for women, don't you think?
Well, there's no socially acceptable option for
Right.
women without hair.
Right.
Men can sometimes shave their head,
Right.
grow a goatee, get an earring, get a motorcycle.
They can make it work.
If that's your look, that's fine. But, there's no socially
women,
acceptable
no.
option for women. So, when women come in and they're losing their hair, My
It's
staff is
heartbreaking. I know
crying.
people that are
My
just
nurses are
devastated.
crying.
Yeah.
We're crying. Everybody's crying. And but the good news is that we can help.
Right. And what's the most popular, like the average woman that walks in there, where would you start if she has hair loss?
First it all starts with the right diagnosis.
So you need to know
when she
why.
comes in, we're going to do a complete medical history. We're going to find out. Obviously, we want to know her, and patients do also contact us long distance. So I
Yeah,
have
I know
many
that.
patients come in from
Right.
thousands of miles away, and it will start with maybe even a long distance consultation. But we still want to get their medical
So
history.
how do you do a long distance consultation?
So patients will go to the website and they'll
Okay.
start their long distance consultation at baumanmedical.com. They'll get a form that they need to fill out with their medical history, their current medications. They can submit photos. They can submit their lab work. We can speak to their existing doctors if they have one and
Okay.
start the process that way. Now, of
Okay.
course, obviously we can't measure their hair or look under the microscope at their scalp until they come into the office, but they can be educated about things that they can do
Okay.
at home with our prescriptions and such that can make their hair grow thicker, better, stronger right away.
What are your prescriptions? I know a friend of mine is on them.
Yeah,
and
so-
she told me she's seeing brand new hair regrowth that she didn't have before.
Yeah, probably the hottest prescription right now in the clinic is called 82M. And that's a topical liquid that is like Rogaine plus plus plus. So
I was thinking it was vitamin therapy. So
no,
it's topical. Okay.
Yeah, so 82M is a topical liquid that is far superior to the old Rogaine, which has been out for 3 decades.
Yeah.
Greasy, gooey, messy, irritating. None of that is what you're going to see with the 82M. It's a very powerful compounded prescription, so it penetrates very deeply and it stimulates hair growth in the areas where you have some hair.
So you have to have the hair follicles there, is what you're saying.
Yes, so that's why the
Okay.
evaluation is important.
You have to know why.
Yeah.
Okay.
And it takes time to see results too.
So how often do you have to apply that?
So that has to be applied. It is minoxidil based, so it has to be applied twice a day, every day.
Okay. And can you give us an idea of what that kind of therapy would cost?
Sure. The topical prescription is about $80 a month.
That's nothing if you're losing your hair. That's, oh, yes.
It really just costs more in time. You
Yeah,
know,
no, I represent a lot of
and
doctors that
discipline.
do cosmetic procedures, and women will pay a lot of money to do their faces and things. But if the hair is thinning or balding, that's their main concern.
Yeah.
That's, I mean, if you don't have that, everything else
Well,
is,
hair is a sign of youth and beauty that you see from across the room.
Makes you look
so
healthy.
it's so important,
Yes.
to have it look good and,
Oh,
and feel-
absolutely.
and makes you feel good. When you look in the mirror, you know what
Yeah.
a good hair day is like. So.
oh, after I get my hair blown out, that's when I'm my happiest.
there you
when your
go.
hair looks good, you feel good, everything's great.
Right.
So I can't imagine the devastation of somebody that is losing their
Right.
hair.
And that's not just a Boca thing, obviously. We have
Right.
patients from all over the Eastern Seaboard, from New York to Chicago to LA to the West Coast
I imagine
and
people
overseas.
would come here because this is a place people want to come anyway. So if you can come here and get your
Sure. So we're lucky we live,
Yeah.
in the Sunshine State,
Right.
and
People can make a vacation
a
out
few
of it.
minutes from the beach, and so many patients do, especially this time of the year. They will come in and have their hair restoration vacation,
right,
And that's what we're
Well,
busy
hair
doing this
restoration
week.
vacation.
Yeah,
I like that. Oh yeah, this would be the time of year. But that makes sense because it's a nice place to come.
Right.
It's not like you're going to the middle of nowhere. You got everything that Boca Raton has to offer,
Absolutely.
and they can get this done while
as
they're
well
here.
as the most state-of-the-art clinic in the world, most comprehensive
Yeah,
treatment
I
program.
really had no idea. I had no idea. I thought, people that had thinning hair, they just kind of had to try to deal with it. And, nobody wants to wear a wig if they don't have to, especially Boca Raton women. We're at the gym every day. We're at the beach. We're out on boats. Our hair's blowing around. It's hot. It's humid. The idea of wearing a wig to cover up your baldness is...
Right. And, so what the take-home message then is to start early while you have some hair left to get those hair
Right.
follicles cranked up. And it's not just, the topical medications. There's other things like laser light therapy that could be done at home with a laser cap. There's treatments in the office. Maybe you've heard of the PRP type treatments, the
Gonna ask you
vampire
about that.
treatments.
Yeah.
So those are things that are lunch hour type treatments to really stimulate a big boost of hair growth.
That stuff really is effective. Huh?
Oh, the PRP works great.
Can you
Yeah.
explain to me how it works? Because I've seen PRP done on the face, and it is amazing.
Right.
But we're talking about stimulating hair follicles with it?
Sure. So PRP, for your listeners who don't know, is platelet-rich plasma, and it's been used in orthopedics and oral and maxillofacial surgery and spine surgery for
The
many
vampire
years.
facial that...
Yeah. So then you've also heard about it in
I think
pop
that's how most
culture,
women know it.
the vampire facelift. So PRP is a platelet concentrate. And there's a special way that we do it with a closed system, so it's sterile, and we have a special centrifuge to separate the
Yeah, I saw that in
platelets.
your office.
Yep, and a special piece of equipment to actually test the whole blood before we spin it, and the blood and the PRP before we inject it to see what the
So you
concentration
know how
of the
much you have.
platelets.
Okay.
Yes, so
And
that
that's
tells us the
important.
dose or the dilution or concentration of the platelets. So under local
Okay.
anesthetic, the area is identified and injected. It is completely painless. You won't feel any of the injections. And the follicles that are there will respond to those platelet growth factors. That's what we're after, the growth
Mm-hmm.
factors. And it stimulates a big boost of hair growth that lasts for about a year or so.
Wow. So you would repeat it once a year?
Correct. So everybody's a little bit different. Sometimes it lasts a little bit shorter, sometimes it lasts a little bit longer, about 10 to 20 months with the methods that we're using today.
So what is it actually doing? You're stimulating the hair follicles that are there so that they produce thicker hair or more hair? Or?
Correct. So the hair follicle is the organ under the skin that makes the hair fiber. The hair fiber that you see is dead tissue, just like your
Right.
fingernail. It doesn't have any live portion at all.
Mm-hmm.
But the follicle can respond to chemical stimulation like the minoxidil we said. It can also respond to the platelet growth factors. So it just so happens the way that our bodies are made that the growth factors within the platelets are the same growth factors that trigger anagen or growth phase at the level of the follicle. So you get a thicker, stronger, healthier hair
And,
for a bit of time.
and I'm a believer in PRP because they're using it all over medicine now, and it's really booming. And you wouldn't be seeing all this if people weren't getting
Oh,
results.
no doubt about it. I mean, we saw a lot of information just recently, about a week ago, at the World Stem Cell Summit right here in Florida. There were a lot of
Mm-hmm.
talk about PRP.
Mm-hmm.
Every aesthetic show that you see, cosmetic procedures show, an expo, you're going to have information about PRP.
Yeah, and they're
American
using
Academy
it
of
in orthopedics
Anti-Aging.
too, and knees and
Oh, yeah.
orthopedic surgery. So it's
PRP is being used all over the body. I mean, regenerative medicine is the next frontier. And so you're going to
mm-hmm.
see a lot of new treatments to help the body heal itself.